The ICD classification system has its roots actually in the 1850s and it evolved from the International List of Causes of Death. The World Health Organization, or WHO, took over the ICD in 1948, making significant updates over the years to improve accuracy and comprehensiveness. So we've had different versions. Most recently, we are using ICD-10-CM in the United States. We do have ICD-11 on the way. It is approved for use, but well, ICD-10 was endorsed by the World Health Assembly in 1990 and it was implemented by the WHO member states in 1994. We did not use it in the US healthcare system until 2015. Now, we actually have two ICD code sets in the US. There's ICD-10-PCS, and that's the procedural coding system, and it's used for patients that are admitted to the hospital, and that's for coding the reimbursement that goes to the hospital facility. So it doesn't appear on the CPC exam. There are no PCS questions on the CPC exam. Those are on like the CIC exam, Certified Inpatient Coder Certification exam. So PCS isn't used in professional fee coding or coding for provider reimbursement. So ICD-10-CM is the clinical modification and is used for diseases, conditions, reason for medical encounters, and other medically notable pieces of data, things like you have a family history of heart disease. And there's slightly different variations of ICD-10-CM across the world. So for example, Canada, they use ICD-10-CA. It's mostly the same, but there are some differences, which is why when people ask like, oh, well, if I move to Australia, if I move to England, can I still use my CPC? Honestly, they use different billing and coding type systems over there. Their insurance and reimbursement is different across different countries. So I know some people that work for the US healthcare system doing like government jobs in different locations, but it's so spotty. Like I can't just say, "Oh yeah, you can go and move to Australia and do CPC coding." And then of course, I don't know how that all works internationally with work visas and so forth. But I digress. ICD-10 is used globally for various purposes. Things like epidemiology, healthcare management, clinical use. It helps us in analyzing general health situations of population groups, monitoring disease interactions, incidences, prevalences, and a lot of different things. But of course, the thing that we primarily think of is that medical billing, the reimbursement, and making sure that we're getting paid for our quality healthcare services. So, making sure that we have accurate coding just in general is really critical for proper treatment and proper payment. So, ICD 10 CM is divided into two main sections, the alphabetic index and the tabular list. The alphabetic index is that A to Z list of all of the different conditions and the terms that you're going to start searching for them, versus the tabular list, that is those numerical listing of the codes arranged by body system, arranged by condition. So this here, the ICD-10-CM index to diseases and injuries, this is our alphabetic index. So this is where you start looking for codes. And then when you find the code, you go here into the tabular list and look up the code and verify if that is the correct code. If it needs additional characters, read the additional guidelines that are around that code. So, for example, if you have a patient with asthma, you're going to look under the A section for asthma. And you can see here, there's a lot of different types of asthma. So we have this default code here if they don't have any other specifics about the type of asthma, but there's lots of different classifications of asthma depending on the different subterms, the type of asthma, or even the severity. And then the tabular list is that numerical listing of diseases and injuries. It's divided into chapters based on things like body systems or conditions. And each code can be as little as 3 characters or as many as 7, depending on how much detailed information or how much specificity we have for that condition. So you can kind of see here from the side of my tabs, we have things like it starts with infectious and parasitic diseases, neoplasms, blood disorders, endocrine and metabolic, mental, nervous, etc., etc., etc. That's why if you are interested in tabbing your book, I actually have a whole video on how to tab your ICD-10-CM book, which I will link in the video description below. Because when you are taking your CPC exam, those little bits of seconds of time that you can save, they do add up. Now you can see here my ICD-10-CM book is the APC edition. So you may have a different edition. You might have an Optum or a Bux or an AMA. You may have different highlights, different icons, all kinds of stuff in your book. But you can see here that mine lists all the different categories of the ICD-10 that are in this chapter. They all start with a letter, so they are alphanumeric. After the third character, there's a decimal point if there's additional characters, and then they have the additional characters here. There's lots of different characters that you need to get familiar with. Oftentimes, the books will have a legend at the bottom. You also need to read your ICD-10-CM guidelines. It will give you all kinds of amazing information about how to use the book, as well as some of the terminology we use in the book. So, for example, you need to understand when we're talking about ICD-10-CM, the various conventions, the various guidelines. For example, NEC. NEC means not elsewhere classifiable, which is different from NOS, which is not otherwise specified. Not elsewhere classifiable means we don't have a code that goes to this very specific designation that was documented. NOS means the provider didn't document the specificity. Remember how we looked at those asthma codes? So, for example, let's say the provider just said asthma and they didn't specify what type of asthma, that would be more of an NOS, not otherwise specified. If they have some very unique variation of asthma where we don't have a code that matches it exactly, that might be more of an NEC, not elsewhere classifiable. We don't have a code that goes to that exact specified type. We have brackets. Those are used to enclose synonyms or alternative wordings or explanatory phrases. And then we have things like parentheses, and those are used for supplementary words that may be present or absent and that doesn't affect the code. So, for example, if we look here at pharyngitis, under pharyngitis, there's a lot of different terms here in parentheses, and they can be present or absent, and it's not going to impact code selection. So if it just says pharyngitis, same code. If it says acute pharyngitis, same code. If it says simple pharyngitis, same thing. But if it doesn't say simple, doesn't change that either. So it can be present, it can be absent. It's just some additional information to let you know, yeah, this is kind of the right area. Let's actually walk through an example. Let's go back to our asthma code. So let's say we're looking for a patient that has asthma with an acute exacerbation, okay? So we're going to follow the indentations for each additional specificity that we're going into. So here's asthma, but this doesn't say that it's acute or exacerbated, right? So we're going to go with, and then we're going to see not chronic obstructive, and we're looking for exacerbation. So here we are. And it has here in parentheses acute, which is just kind of hinting to us, oh yeah, this is the right code because it says here acute. Although if it doesn't, it would be the same code, right? So J45.901. Now, we never code directly from the alphabetic index. We always have to verify in the tabular because sometimes they'll give us guidelines. Sometimes it'll say, hey, if you're using this code, you also have to use this additional code. Or hey, if you're using this code, this other code has to come first, which is not included in the alphabetic index. We have to go to the tabular list to find that information. So here's our J45901 unspecified asthma with acute exacerbation. We don't have any icons here saying we need an additional character, so that is the full amount of the code, that 6 characters there, J45.901. Although if we go back to the category, the J45, there is some instructions here. And it says use additional code to identify if we have this type of asthma, exposure to environmental tobacco smoke, history of tobacco dependence, tobacco use in the perinatal period, and a bunch of other tobacco use codes. So if the patient has any of these additional conditions, it's telling us, hey, don't forget to include it. If this patient's having an acute asthma exacerbation and they use tobacco products, you're going to want to add in the Z72.0 code. We also have some excludes notes. And if we go back here, it also says, hey, don't forget, there's also some official guidelines that we have regarding asthma. Check the official guidelines here, acute exacerbation of chronic obstructive bronchitis and asthma. So that might be telling us some information. If we're getting a report that the patient also has bronchitis, we're going to go, oh, you need to go back, check these guidelines. Now, some of the editions of the books that I like, and I think most of them do this now, they'll have the chapter specific guidelines at the beginning of the chapter. We have a lot of general ICD-10-CM guidelines, but then there's also ones for each specific chapter. So this one is our chapter-specific guidelines for coding for diseases of the respiratory system. So go through your guidelines. They're really, really important. ICD-10-CM includes a lot of specific guidelines for various conditions. For example, HIV, requires knowing if the condition is asymptomatic, if the patient has a related illness. And there's just a lot of different things to consider when coding for HIV and AIDS. Same thing with sepsis, MRSA infections, neoplasms. They all have a lot of detail regarding what the documentation has to say to assure the precise coding. So, to accurately look up a diagnosis code, we have to determine the main term. If you're not sure what the main term is, pick something. Typically, it's not, though, a location. So, if it's elbow pain, don't look up pain, look up elbow. I've made some videos before where I talk about if you look certain things up in the alphabetic index, it will say C condition. So, again, elbow pain, if I were to look up elbow, it would say C condition. Well, what's the condition of the elbow? Well, it's in pain. So, look up the word pain. It doesn't mean look up the word condition. It means what's the condition of that thing that you're looking up. So if you're looking up stomach ulcer and you start with the word stomach, it might say C condition, and that means you're supposed to look up what's the condition of the stomach. Oh, it has an ulcer. So go look up the word ulcer. Now, when you're learning, it takes some time. Sometimes you might look up a main term and it doesn't take you anywhere. Pick something else, but just start going. There's no real definitive hack to say, oh yeah, this is definitely the way you need to look up main terms all the time. Look it up in the alphabetic index, find the term in the tabular list, confirm the code, check all of those different notes and instructions. Some of the most common mistakes coders have are coding directly from the alphabetic index without verifying in the tabular list, not coding to the highest degree of specificity based off of the documentation, or overlooking notes or instructions. So always double check. Now let's actually go over a few examples. So I'm actually going to start out with one that's going to be a little bit tricky at first. What ICD-10-CM coding convention does the diagnosis code caudal cervical inflammatory spondylopathy, which is assigned code M46.82, illustrate? So let's go into our book and look up M4682. So M4682 is other specified inflammatory spondylopathies cervical region. And what did we say those other specified codes are? There's a difference between other specified and unspecified. And let's actually go back and look this in the alphabetic index so I can kind of show you more about where you could find some information regarding this. So if we look up spondylitis in the alphabetic index, there is no distinct code for this condition, even though we've got a specific nature of the statement. So in that case, is this a NOS or an NEC? Is it not elsewhere classified or not otherwise specified? Well, they specified what type it is, right? We've got it. We've got the specification in the question. So in this case, they did specify it. We just don't have a specific code, and that is what we refer to as the not elsewhere classified codes. Now, which ICD-10-CM code corresponds to a sore throat? We have RO7.0, JO2.9, JO2.0, and J31.2. I'm actually going to use, I think, my book for this one. So what's our main term? Is it going to be sore or is it going to be throat? Remember, we said not to look up locations or body parts. So probably not throat. Let's try and look up sore. And if we can't find anything there, then we have to maybe think about what is the term for a sore throat? Like the medical term, it's pharyngitis. But let's kind of take a look. I want to experiment a little bit and see if we can find the sore throat code by looking up sore. I'm curious. So in our book, we're going to go here to our alphabetic index. We're going to click on S. And we can scroll down. You can use this magnifying glass to search terms, but sometimes it brings up like every instance of that in the book and might not get you to where you're looking for as fast. I think we can also do a control F here. Let's take a look. Sore. But see, now this is under something though, because look, here's septicemia. So we're not alphabetically under sore. Sore. Okay, here we go. Sore. Sore. If there's a throat under here, hey, how about it? Sore throat. Also see also pharyngitis. Now this particular one isn't any of these specified ones. So yeah, I guess we should go and check pharyngitis. I wish the book though would let us click and just go over to pharyngitis, but maybe one day. Let's do our little control F. So pharyngitis, click. Here we are, pharyngitis. And J02.9. I just realized I'm in my 2023 version, and that's probably why it's not letting me click on stuff. Okay, I hopped over to my 2024 edition. Now I can click there and it'll take me right to the J02.9 code. So J02.9. And also, look here, we have some excludes notes. We don't have, I'm seeing yet any additional code additional type stuff. Let's see, J02.8 has some use additional, J02.9 does not. So J02.9, acute pharyngitis unspecified. So that is the code that we are looking for here. So sore throat, J02.9. Next question, which ICD-10-CM codes should be used to report an enlarged prostate with urinary retention symptoms? When you see this little apostrophe S here, that means there are some options that have only one code, like B and C, or some that have multiple. So we're saying it could be one, could be multiple. So that's why they have that in parentheses there. So we have a couple of options here. They're all in the N40. So if we're taking our CPC exam, maybe we would just want to go to the N40s and take a look there. But for the purposes of this, if we go into our ICD-10-CM alphabetic index, where are we going to start? So we're not going to look under prostate because that's our location. What's the state of the prostate? It's enlarged. So let's try there with the enlarged. And I'm going to go back here to my book. If we click these little cheeseburger menu over here, it'll bring your directory stuff back up. So let's go here. Let's go enlarged. So if I do E for enlarged and then I go do my control F instead of doing the search, it'll just search this section. So here we've got our enlarged prostate and we have the not otherwise specified code, but then we also have with lower urinary tract symptoms. And this patient had a UTI, so that would classify as that. So N40.1, it didn't say nodular. We're going to go to our N40.1. And it says use additional code for associated symptoms when specified. And let's see here. What have we got? What did this say? It says the patient has urinary retention symptoms. So let's take a look at that. The urinary retention. So we're going to use our N40.1 and it says use additional code. So N40.1 would be first and then what? Our urinary retention. R33.8. So in that case, it's going to be our option A, N40.1, R33.8. Now here's just a general question about ICD-10-CM, and you are going to have some questions on the CPC exam that are just about guidelines and how to code correctly. So this question is, a combination code is only assigned when that code fully identifies the condition or when directed by the blank. So what's going to fill in that blank? When directed by the documentation, when directed by the physician, when directed by the index, or when directed by the guidelines. So a combination code, meaning a code that has two conditions combined into one code, that is assigned only when the code completely identifies all the conditions or when the index specifically directs the use of that combination code. So in that case, it's going to be when the index. So this ensures that we are having the complete code assignment in accordance with the ICD-10-CM guidelines. Last question, what is the ICD-10-CM code for cancer of the esophagus? So cancer is a neoplasm, a malignant neoplasm, which means in this case, we have to use our neoplasm table. So in our book, that's over here, our table of neoplasms. This on the AAPC edition doesn't link directly, so we have to find the code and then look it up manually in the index. So here's our esophagus, and it breaks down different sections, but this one just said esophagus. The first code is our malignant, then our secondary, in situs, etc. So this one would be our column for malignant primary, so C15.9. So we'll go over here, C15 through C26, and here is C15.9, malignant neoplasm of the esophagus unspecified. So that means the answer to our question here is our C15.9. So that wraps up our review of the overview of ICD-10-CM, which coordinates with your Chapter 3 of the CPC curriculum. Hope you found this video helpful. If you did, don't forget to give it a thumbs up, share it with your friends, and possibly with your students. Don't forget to like, share, and subscribe for more coding tutorials. Thanks for watching. I will see you guys in the next video. And until then, just keep on coding on.